Hi, I'm Dr. Cindy Toner from Nova Spinal Care. My husband, Dr. Jason Plutsky, and I have been in practice since 2003. One of the things that we find very important with all of our patients is that we want them to be informed. And what I'm about to go through is a lot of the information that we find important so that you can get better results more quickly while you're under care. One of the reasons I'm a chiropractor is when I was grade 8, I'm from a small town in northern New Brunswick, Grand Falls. When I was growing up, my dad was a potato farmer, and what he had to do for 14-hour days for 3 weeks at a time during planting and digging season was to sit on a tractor that is not unlike what a lot of people have to do sitting at their chairs, at their desks. So my dad had to sit on a chair that didn't even have a swivel, where he would be sitting like this, and then he'd be turned and looking back at the rows for hours at a time. What we found with my dad is that he would get sore, and then he would be able to get over those episodes. But what started to happen is that the episodes were lasting longer and longer. He got to the point where he walked in and he was what we call antalgic. He could barely walk. And so during his very small lunch break, he would be laying on the couch with a heating pad. So my mom said, "We're very busy. We need to get this taken care of." Off he went to the doctor. Not unlike a lot of our patients, when he came back from that appointment, he walked in, and I still remember his face. It was like he had lost hope, because he came in and my mom said, "What did she say?" And he said, "She took x-rays and she said, I have an old man's back." And so for my dad, that created a loss of hope because he was such an active person. And so she told him, "You're going to have to stop running. It's only going to get worse over time, and take these pills to get over the episodes." So my mom looked at him and said, "Well, that's not going to work. Let's get another opinion." So he went to the local chiropractor. And what that chiropractor told him, I'll never forget when my dad came back from the chiropractor, because he came back in the kitchen, and I still remember where I was standing, and he came right up to me and he said, "I know what you're going to do when you grow up." And it wasn't that he was magically cured from one visit at the chiropractor. It was the information that that chiropractor went over with him that turned his life around. It was like a cross in the road, and not unlike a lot of our patients, this is, we want to give you the opportunity to choose what you want your future to look like. Fast forward to today, my dad is 75 this year, and he still runs 10Ks. In fact, he did it under an hour recently. And instead of, him aging and not being able to do the things that he loves, he's been able to create a whole different life for himself. That's what we want for our patients. So we call that thriving versus surviving. That's what we want for you. When I go over some of these things, you're gonna wonder, why did I not hear about this sooner? Because it's gonna be so simple. There may be things in your life right now that you know that you didn't know even a couple of years ago, that you kind of wish, I wish I had known that little thing. A lot of this we learned a long time ago. It's common knowledge, but we forget how to apply it to our own health. So not unlike this. So this is a gas gauge, and most people are unaware that this has been around since 1997. This little tiny arrow here, when you're driving your car, so if it's not your car and you're in a rental car situation and you're in a rush, that little arrow indicates which side to put the gas in. So this has been around for a long time. It should be common knowledge, and it's not always for most people. How do you know if you're healthy? So that's one of the questions we love asking people, because the way we look at health here is different than the way mainstream looks at health. One of the answers that I always get to this question is looking good and feeling good. So why would I work so hard to be healthy if it didn't mean that I felt good over time? Is it possible to feel good, and I say it like this, feel good, but not be healthy? One of the things that we find in Nova Scotia, and probably throughout North America, I would say the stats are the same. The top 3 killers of our healthcare system, you can have and not know, and be without symptoms. For instance, one of the big ones is cancer. So I bet anybody watching this knows somebody who was feeling good and then was diagnosed with stage 4 cancer and died shortly after. That can't be healthy. Another one, diabetes. It's so common Doesn't mean that it's normal, but there's so many people who go in for, a routine blood test, even for their life insurance, and find out from that blood test they were symptomless, but that they have diabetes. So that's a big one. And then another one is cardiovascular health. So that's a major one, and one that took my husband Jason's dad's life. And that's really close to our heart and so many people that we know. So we want to look at things a little differently. Because if you have symptoms, which if you watch TV and you watch commercials, what do they tell you to do? They tell you to ignore the symptoms. So I'm not against drugs. We are not against drugs. Oftentimes they can get you from where you are to where you want to be. Take a drug and then it will make you feel better, but it doesn't necessarily make you heal better. So drugs and surgery, by the time people get to us, they've not only gotten over the first one, where just like an engine light in your car, if the engine light went on, yes, it's annoying, but if you put the duct tape on, guaranteed, you're going to probably have more trouble when you go back to get your vehicle checked. First time, people will ignore it, and then they go to drugs and surgery. Most people get to us around this phase when they're frustrated. And so we like to do something a little different. We like to figure out what's causing the loss of function, because we believe that health comes from optimal function. This right over here is something that we all learned in high school biology. So when I go over this, I like to talk about the brain. The brain tells the body what to do through that white cord going down the spine. That white cord is called your spinal cord. I like to refer to it as your power cord, because that power cord is connected to the brain, and it's sending signals. It's sending strength and energy to all the glands and organs of your body. If you can imagine, if somebody has stress along that spinal pathway through poor posture, which is one of the things that we measure, then they're going to probably have a decrease in the energy going to their glands and organs. In fact, if you think of people as they age, or even simply teenagers now who are in this position long-term, poor posture, what we're seeing is that we're seeing a lot of the symptoms that usually would come out when people are 40, 50, or 60 a lot sooner, because people have poor posture much sooner. So we have this heavy head that weighs 10 pounds for every inch that it's forward. So if you're texting all day, it at least doubles the weight of the head. So if you go to the gym, I challenge you to pick up a 10-pound weight and see what feels easier, to hold it close to you or hold it further away. And you'll find that just like the head sitting on top of the body and the spine, the more on center it is, the less stress you'll have. So that's one of the biggest things, is that if we as chiropractors can measure your posture and change the stresses going down the spine, then oftentimes we can see changes in the strength and energy going to your glands and organs. The 3 top side effects that we have here, oftentimes, especially in females, we'll see better reproductive cycles within a few months, and with most people, better sleep, and then better digestion. Those are just some of the great side effects that you can get from chiropractic care. So this is just as I was explaining, what is normal posture? So normal posture is where that heavy head, the center of your ear, and if you want to check this on your kids or on yourself, the center of your ear should be above the center of your shoulder, hip, knee, and ankle. That should make one straight line. If that line breaks down, then you're going to have added pressure on the spine, which can affect ultimately your glands and organs over time. And this is one of the things that we do every time patients come into our clinic. So we measure posture. We like to do it standing first. So one of the things that we're looking for with standing posture is to see if somebody has head tilt. We check to see if they have a high or low shoulder. We check to see if the hip is high or low on one side or the other, and then a twist in that system. And then we check people face up and face down to also see what those presentations look like. Because one of the things that people forget is that from the side, the spine is it's supposed to be so structurally sound, it actually has 3 curves. So babies should technically go from being in the fetal position to by 12 months. In order to be on the normal development chart, they should be able to go from being in fetal position to at 1 standing upright against gravity. Now, a lot of things have to happen in between that for this to be optimal. And one of those things is the baby will go from, being in the fetal position to then eventually being able to do some tummy time to then a very important phase, crawl. And when they're crawling, that's how you develop the curves in the spine. Once that spine is strong enough, then the baby will actually start to stand, and then that heavy ball will be balanced on top of a structurally sound spine. Versus some babies who are locked in a stressed position, sometimes they'll even skip the crawling phase and go right to standing, and parents will mistake that for, oh, my child is developing very quickly, when really it's a milestone that they've missed, a developmental milestone. So that's very important. That's one of the things I love to check when I'm checking babies and kids. So we have 3 boys, and they've all been checked since birth. They all had natural births and deliveries, and all of them needed an adjustment at birth. So I'm fortunate to be married to a chiropractor who was able to do that. But one of the things that we love is that we take care of patients from 1 day old to our oldest patient, I think 101 years old. So everybody in between that can qualify for chiropractic care. One of the questions that people always love to ask us, and I would feel the same way too, starting something new, is how long is it going to take me to heal? Just like a broken bone, if you break a bone, my sister recently broke her arm, and the first thing they had to do was reset it. So not unlike what we're doing is we're adjusting you to be in a more optimal position with gravity, taking away the stress. So oftentimes once somebody's casted, they won't be in pain for the 4 to 6 weeks while that bone heals. But if they took off the cast too early, it would affect the healing process. So for us, when we're adjusting people, we'll have patients sometimes even after that very first adjustment get up off the table and feel significantly different. That doesn't mean if they feel different, it doesn't mean that they're already going to heal. So there's a big difference there. And what you do in between visits, which we love to coach people on lifestyle choices, is also going to affect how quickly your body heals or not. Just like braces. When I had braces, I had to wear a retainer for what seems like an eternity because your teeth are bones and so is your spine. So the reason you're watching this is because we wanted you to have freedom of choice. So if you're going to start here, everything we do at this clinic is about empowering our patients to have more knowledge about their health. Most people have either never had x-rays done or never been shown their own x-rays, and we love that. And with kids and babies, we like to explain to the parents what's going on in their spine as well. Oftentimes, we don't even need to do x-rays on those kids. So this is an example of a patient that we saw years ago. And so when he came in, his spine looked like this. So Jason took his x-ray. And so if you're looking at this, we're looking through him. This is his lumbar spine, the lower part of his spine. So this is his pelvis, and you can see here that he brought us this x-ray, which was from 10 years prior to starting care with us. And so we looked at it, and the interesting part is when you put a heavy ball on top of this spine, you can see here, without even being a radiologist, how quickly over time that can disintegrate. Now what we have to keep in mind here is that this spine over here, what is it protecting? It's protecting your power cord. Your power cord is how the brain tells the body what to do. If I was going to choose how I wanted my power cord to be protected, it would be neither of these. But if it was this one, I would make sure that over time it wasn't moving in that direction. So we're always setting the stage for our patients to think of the future. And then this is another case where we have somebody who, a 25-year-old rugby player, came in with shoulder issues. And so we can see here in the neck how terrible the posture is. It's barely on the screen. His head is forward. And so that's going to put a lot more pressure on his whole spine. So this is not the kind of curve that you want, but this is a curve that we're seeing a lot on teenagers right now. Way too often. So what we would love is over time for that to change. And so we can see here it already started to straighten out, and then eventually it regains its curve with a lot of work. It's a process. One of the scans that we love to do is a postural scan. So when you begin care with us, for example, this lady, when she started with us a few years ago, you can see here how the green line, as I was mentioning, the line that is supposed to be one straight line, you can see on hers how far forward her head is. Now, because her head is so far forward, what do you think it does to this part of her spine? It also makes it round, which happens a lot in a lot of our patients. And so we can see here that there's a breakdown in that line. So over time, and in this lady, it was only 6 weeks where we could see the changes. It almost looks like she lost weight with the change in her posture, so drastic. And again, this is only 6 weeks later. So we do these scans periodically over care to measure changes over time to make sure that you're getting better. Same thing from the front. So our bodies are three-dimensional. We can see here how this green line should be intersecting with the center of her nose and how far off she is to her left. She's off to the left of center. And again, within only 6 weeks, we could see the changes where now her whole body is more on center. So when you think about that from a weight joint, like a weight-bearing perspective, so those joints, like the hip joints, the knee joints, and a lot of people who say, you know, I have to get a hip replacement because I'm getting old, or a knee replacement. Well, then why don't you get both hips replaced? Aren't they the same age? And so this would be one of those reasons why, is because when your body is out of alignment, there's abnormal wear and tear. Same thing with this man. So the green line, he's so far forward of the green line, and then we can see here how those lines are getting more on center. Same thing from the front. He's almost antalgic here, which means he's totally off to his left. And then again, within a very short amount of time, we're seeing that as his body unwinds, that heavy head is becoming more balanced on center, which then allows his body to have more energy for healing, for digestion, for all of the things that the body needs to do, aside from just holding us up against gravity. Our hope from you watching this brief video is that you understand that when we ask the question, who needs chiropractic? Anybody with a spine. So we take care of people, babies from 1 year to people who are 101 years old. That was our oldest patient. And so anyone in between with a spine needs to have their spine checked so they can have a healthy, functioning nervous system. Because what we want for you, when you're thinking about your health, is if you think of your health 5 years ago, what is it like? What was your health like 5 years ago compared to where you are today? And if the answer to that is that your health today is more compromised than it was 5 years ago, then this is a really good time to change that. And so I call it the health trajectory, because if you were here healthy and 5 years ago and then it's gone like this since then you're going to have to use a lot of tools to get this back up so that in 5 years you can be healthy again. So one of the things that we like to do is start with your spine and nervous system. We would love to take care of you and your family and your friends, and we hope to see you at the clinic.